If you are paying high prices for health insurance, you need to go private. That's the life lesson for today. Because unfortunately, we all know that insurance is a scam. And David Krisloff, he didn't get the benefit from that because, his time is gone and he didn't get to experience robots and everything else. But
the guy's a legend, though.
I want to show you guys the scam. All right. And I'm not going to make this deep because it can get deep. I just want you guys to think about something. We all know insurance is really expensive. But did you know that paying out of pocket, they have a different pricing system for that comparative to what the insurance companies have already allocated money? It is a lot of times cheaper just to ask the hospital, what is a fair estimate as a non-insured person comparative to not? So here's the thing I say. I don't know if everybody's going to do. Actually, I think nobody's going to do it, but I'm going to say it anyway. Everybody tomorrow, cancel your insurance. Everyone.
Done.
And use
I already did it yesterday.
The emergency room. They cannot refuse service. They're going to send us all a bill.
You're saying car insurance or health insurance?
Health insurance.
Oh.
Everybody cancel your health insurance and use the ER.
What if I'm on Obama's care?
Everybody cancel your insurance. And when you have a serious problem, you use ER. You pay out of pocket for small things and serious problems. Everybody use ER. They're going to try to bill us all. And we're all not going to pay. They can't sue us all. If there's 350 million people in the United States and we all don't pay, they're going to have to do something. But I want you guys to know, paying out of pocket is a lot cheaper than paying your monthly payment for insurance, and then you got to pay a copay on top of that. And sometimes, a lot of times, none of this even gets paid until you pay your deductible, which can be anywhere from $1,500, $2,000, $3,000, up to $10,000 before insurance even starts picking anything up. And you're already paying a premium every month. So this is what this doctor wants to show you, and I want to show you guys too.
One thing I've learned not taking health insurance for the last 4 years as a doctor is that the only thing you're guaranteed having commercial insurance is that you're going to be charged more for things. So what do patients do who don't have insurance, who need these things above? They just pay cash and they get it for cheaper. And their doctor does not have to jump through hoops to try to get it approved, only to have them be charged more than what it costs. For example, if a patient needs an MRI of their spine, normally insurance companies require them to do physical therapy, try medications, and the doctor has to do what is called a prior authorization, pre-certification, or a peer-to-peer. To basically do all these things to get the insurance company to say, okay, we'll let you have this test, but we're going to charge you $1,000 instead of the $280 that it costs cash. So all these things above are actually pretty affordable if you just pay cash for them. And that's why I think that a lot of people are opening their eyes to health insurance being quite a scam, as a matter of fact, and they're opting to just go cash pay.
And so this is the same doctor, and she's going to show you now. She has a patient, and she's calling around to places because one of her patients needs an MRI. And normally an MRI would cost anywhere on insurance, if you have insurance, anywhere between $800 to $2,000 for that. And she's going to show you, she's going to say, I have a patient, has no insurance. What are the prices? And you're going to see there's a huge price fluctuation.
I was calling to get a quote for an MRI scan for a patient who's self-pay.
Okay.
MRI lumbar spine without contrast.
Self-pay total is $729.96. Originally $1,869.45, but with a self-pay discount, they'd only pay $373.89.
Do they need to pay that amount up front, or could they put that on a payment plan?
So it kind of depends on the patient. If they have a lot of debt here, then we would probably ask for at least half up front.
You said MRI of the L-spine without contrast?
Yes.
Okay. It'll be $1,248.75, but we have our discount. Let me see how much that'll be. The total after the discount would be $433.32.
So that's the self-pay discount?
Yes, that's with self-pay discount. I just know whenever we do like the private pay, we go ahead and add that discount to it. So all you would owe is at $433.32.
I understand you need an estimate.
Yes, please.
Do you know, does the patient have any kind of insurance?
No, they're self-pay.
So after the self-pay discount, they're looking at around $1,067.22. She said that that's just the way it is on there. I don't know if the price has changed or what. I do know that in the past I've seen them for less than that, so I'm not quite sure.
You wanted to know for MRI lumbar spine without, correct?
Yes.
All right, so the self-pay price that they can pay on and then pay on monthly is $1,791. Or they can do a self-pay discount price of $209.05, but that does have to be paid the day of the scan.
Wait, 209?
$209.05.
Oh, that's really, really good.
So what this shows you is just like you do with your car or anybody else, you need to shop around. And you call and you ask, I'm a self-paying person that has no insurance. And you can see how much the difference is. And so all this shows you is there's a scam. Insurances have this flat cost, and you're going to pay that no matter what. And if you haven't met your deductible, you're paying all of it, plus your premium. If you say, I have no insurance and I want a self-pay discount, and you do your due diligence and call around, you can find yourself huge discounts. And you're not even paying a premium. You're not paying insurance every month. And so for people out there, at minimum, all I want you to see is, if you didn't know, at least take that advice. Call around, say, I don't have insurance. Who cares if you have insurance? Now tell them, I don't have insurance, and I want a self-pay discount. You can find yourself in heavy benefit of a reduction of pay, and then you might find yourself saying, why am I even paying this premium? And they're not even covering my costs until I hit this $5,000, $6,000, $7,000, $8,000 deductible.
Well, not only that, one step deeper, it actually shows that you can call around, and there's even a huge price difference with self-pay as well, which also shows, and all these hospitals are using the same equipment, same electricity,
that's right,
all that, but you can clearly see how much, that itself could be taken to court. I feel like you're charging, so you can run this equipment and still get paid. The hospital can get paid well overcompensated just by $209. Why are you charging over $1,000 for a self-pay?
It's a scam.
Because they can.
That's it.
And what you could do instead is take what you're actually paying now and put it into bank, and then you could only use that for emergency. And so, like, if you go in there, you pay $200. I mean, most people pay that into insurance one time or 2 months. 1 or 2 months.
Well, not just to mention,
but now it's your money still,
right?
So, it could be an insurance like buying a new iPhone sock.
Yeah, that's true. You could actually take that money. You can buy a new iPhone sock.
Yeah, of course. Any other luxury that
you don't have to get a used
one. I wonder if
Samsung
fits in those socks.
No, the iPhone doesn't want you to.
That'd be like a buy.
No, you might have to get a Magnum size for the Samsung.
But they want you to be reminded
to think that they can do their own research.
Don't do any of your own research.
Doing your own research is associated with conspiracy theory circles.
This go-it-alone approach, doing your own research, that can have serious consequences.
You should get prison time for even questioning the vaccines.
Can we all stop saying, I need to do my own research? That phrase, do your own research, it's 4 words. 4 little words that are hurting America.
Doing your own research hurts America.
Everybody has a supercomputer in their hand that empowers them to do their own research, and that's the problem.
You must not do your own research.
I need to do my own research.
I don't understand what that means. I'm doing my own research.
You can't do your own research unless you're a scientist. Do your own research.
Maybe you've told yourself you're playing it safe. You just want to wait and see since this is a new vaccine. No.
Roll the up and get the vaccine.
Unvaccinated people spread the virus.
So they don't want you to do your own research.
That's crazy.
So I'm encouraging you. Do your own research. That's what I'm saying. And so regardless or not, maybe some people it's one way or not, maybe some people it's better or not, do your own research and figure out that there's a whole corporate schema going on. And there are ways to get out of this matrix network.
Yeah, you might actually be able to, like, next time your friend leaves their phone on your coffee table, or your parents leave their phone on your coffee table or in your view, instead of like taking it and taking all these selfies and all that stuff, just start whispering into the microphone, give me ads to do my own research or something like that, because Google's gonna pick it up for you. You know, it's gonna hear it and it's gonna start giving them ads to do their own research. Hopefully,
I don't know.
That one kid started doing it.
Therapy, online therapy, free therapy, therapy for adults.
Yeah. Well, all I can say is that's why you need to think about the good old days, the days when we had pennies, the days when we could have vacations, the days when we weren't working just so we can have health care, the days when
we had 2 nickels to rub together.
Yeah. Those days are gone. But that's what we wanted to bring to the table this week here on this week's episode, a penny for a prison.
You know, I actually used to take 2 nickels, and I just love that sound when you rub them together. It makes a very specific sound when you rub them together. That's why, that's where that mantra comes from, rubbing 2 nickels together.
I didn't know that.
Oh, now you know. Don't do your own research.
No, I think you should.